The podcast where we pull back the layers to find out who the speakers are behind their name, credentials, and organizations that they work at. My name is Sean Pitcher. I am your host as always. You can find me on Instagram on Sean_TacticalRD. Today's guest we have on is Jacob Fleck, who is a health optimization specialist working with athletes, bodybuilders, general population to help improve their behaviors, health, and optimize their performance. I've been digging in a lot with talking to individuals that have a lot of expertise on biomarker testing, how to optimize those levels, doing that through food, supplementations, or possibly other means to be able to help improve in those different situations. So, Jacob, really appreciate you for taking the time and coming on to be able to provide some of your knowledge and background on helping us kind of understand this topic a little bit more.
Yeah, Sean, thanks for having me, man. It's a pleasure to be here, and I've been looking forward to this for about a week or so now.
Fantastic. So the question I start with every single person, Jacob, could you please tell us what is your roots? Who is Jacob?
Yeah, so I recently just moved back to Indianapolis from Tampa, Florida. I lived there for about 3 to 4 years. I loved it. My wife and I are just weeks away, awaiting the birth of our first child. So about to be a father. I work for Marek, which arguably is the epitome of health optimization in the United States via telehealth. But me, I come from very, very simple roots, similar to the podcast itself. I grew up in a very small rural town in southern Indiana. I had a graduating high school class of 22 people. And, it's very important to me to be relational, but also implement certain things and certain approaches in your life that are spoken about generationally. So the choices that we can make now can lay really, really good path for not only ourselves in the future, but our family as well. So with that being said, I think that above all else is, I'm a very strong Christian man, and that's very important parts of my life as well.
Congrats on the child. I know that's going to be a big endeavor for you. And I hear always a variety of different stories out that comes with a new kid. I'm sure you'll have a couple of sleepless nights for sure.
Yeah. The sleepless nights are definitely coming. I would say they've probably already started, but that's where wearable technology, things like that, can really come in handy. So my wife and I are just really trying to prioritize the downtime that we get right now before we have all the responsibility coming our way here soon.
So you mentioned wearable tech. Do you use a Whoop, an Oura Ring, anything in particular?
Yeah, so I'm actually training for my first marathon at the moment. And after all the research that I've kind of compiled, I'm a big fan of the Whoop. I'm a big fan of the Oura Ring. But I found that a very good common denominator for that is like Garmin watch. So it tracks my VO2 max, HRV, and a lot of other ancillary things that are a necessity for marathon training.
Do you feel the combination of the Garmin and providing it details is superior in comparison to the other ones? Or is it just from a cost perspective? Because obviously a Oura Ring will cost like $300. I guess any insight on that? I've got a lot of obviously feedback recently for some of the sports scientists I work with that Oura Ring seems to be kind of the top-notch option out there right now. And obviously things are still developing and still improving. But any thoughts or opinions on that?
Yeah, no, I completely agree with you. I think Oura kind of holds the top of the chain in that regard. I just found the Garmin to kind of be a good common denominator. Notoriously, I've only really exclusively worn Apple Watches, and it just got to the point where a lot of the things that I felt were a necessity were not. The accuracy was not there. So Garmin, the reviews, the coaches that I've kind of garnered in my corner, coaching me through my first marathon, coming from a bodybuilding background, is very complex, but it's also very similar in training style. So I wanted to have something that kind of meshes in cross training. So marathon running, but also able to kind of gather information through a hypertrophy standpoint.
And who would you say a lot of your mentors are? I know you work with a whole variety of different populations, and there's obviously different professionals and practitioners in those spaces. But maybe who are the top three people I don't want to say relate your success to, but have been able to pull you aside, give you information, teach you, educate you, kind of bring you up in the field to help you to kind of the position you are now?
Yeah, I mean, that's a really great question. It's a little bit more complex than I'd like it to be, just because this field that we're currently working in is so diverse and it's very niche too. So I would say I had my background primarily in bodybuilding, and I've competed in several bodybuilding competitions. I got to work with some of the best coaches and best athletes on the planet, not only training from them, but also learning from them. So I
Mm-hmm.
learned through experience, but I also learned through a lot of other people's experiences, biochemistry, their subjective information, cross analyzing that with their objective information. I'm able to kind of see through lab work. And with that being said, too, I mean, there's so many different online gurus now. You really just have to sink your teeth in and start to digest information that you can begin to understand, because it's just like a first grader reading a book over astrophysics. It's not going to be uh, understandable at first glance. So it just got to review, wash, rinse, repeat type of thing.
So who should be some of those individuals that we should follow? Because I even say the same thing, right? Like 90% of the stuff on social media is trash, right? There isn't, a lot of it's to click things, to buy things, to provide a cookie cutter method, to get them to make obviously some type of money. But it tends to be hard at sometimes to be able to dig through all that to find like who are the actual legitimate individuals out there providing these types of services that are going to give you a high quality service and actually put you in a position to make the change that you want to make.
Yeah, well, there's a lot of coaches that put a lot of information out. Who I learned from specifically through YouTube is like Derek More Plates More Dates. Obviously, he's part owner in Marek, but also Peter Attia. But from a personal relationship and athlete standpoint, I worked alongside and was able to train with for a large amount of time this year's Mr. Olympia winner, which, if you know anything about bodybuilding, he not only won the 212 in 2021, but he won the open division this year. So I was blessed. We actually grew up very close together in proximity. I'm very near and dear friends with he and his wife. So is my wife and his wife. So um, they're more so like family than anything to me. But getting to
Yeah.
understand all of the intricacies that go into a bodybuilding prep and then have him coach me through one um, in the mindset of a Mr. Olympia is it's incomparable. But it's definitely a journey I would recommend for people to try it once in their life, because your body is so insanely responsive. You don't understand all the complexities and things that your body naturally does that can be manipulated to look at and look a certain way to elicit a certain result.
Yeah, it definitely takes a different level of dedication than maybe the general population or most people will probably think about that they have to do. Um, why, why, in your opinion, is getting routine blood work important? Whether it's a bodybuilder, gen pop, an athlete, like, what's the whole purpose behind why people should do this twice a week, twice a year, every or 3 to 4 times a year?
Well, every person biochemically is entirely different. They're not going to respond to the same variables in the ideal and exact same way. So it's important to understand how are we different and what is considered optimal versus what is considered the norm. When you're going to get lab work, LabCorp and Quest both have different reference intervals that are they're considered a normal range. But what's normal is the average of a very unhealthy population. We don't want to be in the unhealthy average. We want to be the extraordinary version of that. We want to be the healthy version of that. So, understanding what deficiencies that you have, whether that be hormonal, nutritional, could be an epigenetic predisposition. These are all contributing variables that lay waste to your overall health and can impact the longevity that you have in your life. So I think that something that a lot of people run into is you're going to fight tooth and nail to go to a general practitioner, PCP, whatever have you, and beg them for lab work. But normally, whenever you are getting labs done, the whole process kind of is talk with your GPP, ask for labs, and you might have to ask for 2-3 months to get that. When you get your results back, they don't know how to interpret it. They just tell you, this is off, this looks folded, this looks folded, here you go. They don't give you a comprehensive analysis of how's everything intercorrelated, how is everything translated over to like organ systems, deficiencies, things along that line. So you never really know where you're going until you first know where you are. And if you don't know where you are, you're never going to improve, right? So that's the first step of optimization, is knowing where you are and what you're deficient in, and then mitigating the risks and abnormalities that you have by the input of healthy habits and sometimes nutritional and supplemental pharmaceutical intervention. Sorry, that was really long-winded.
That's okay. Yeah, I mean, even like I had a recent client last week. I was talking to. We got his lab work done, and some of his hormonal levels were low. And he's like, "Yeah, I had got this done previously. My physician just said, yeah, sometimes people have fluctuations in their levels, but yours is still in a normal range." And I'm like, well, it's in a normal range, but it's definitely low normal for where you want to be. And, he was having several different symptoms and situations where he wasn't feeling too great. I'm like, yeah, yours is probably actually too low in comparison to what your possible norm could be. And I know I've had a lot of conversations, especially around testosterone, free testosterone. I know different people feel different. You might have a guy who feels great at a 500 testosterone, but you might have another guy, if he was 500 level testosterone, he's having a myriad of symptoms, and maybe his norm is going to be an 800 or 900. And I think that kind of goes back to what you said there. Like, there's just so many differences individually from person to person, to be able to just give a normative range or value and not look at what's high normal, what's low normal, what's optimal, what is a optimal or normal range for a certain group, right? I think if you look at athletes, or you look at tactical personnel, or you look at bodybuilders who are putting a lot of stress and strain on their body and taking a lot of nutrients, macro and micronutrients, how can we say these lab flip ranges are their normal? I think, it's almost like another class of their own.
Right, and just to kind of expand on that whole idea, is if we're working off the idea of predetermined reference ranges based off the average amount of the concentrated population within the vicinity, then let's take this in for instance, right? We have a 300-pound NFL linebacker versus Jimmy down the street who's 140 pounds sopping wet. Do you think that they're going to have the same reference ranges? Do you think they're going to have the same optimal ranges in which our body feels the greatest? Right. So it's little things like this that really go a long way. And what I tell patients a lot of time is that let's think of it this way. If you have cancer, you're going to go to an oncologist to seek treatment, right? If you have an endocrinological deficiency, nutritional abnormality, are you going to go to your general practitioner to receive general knowledge, or are you going to seek out a specialist? Because that's really where the line is drawn, quite frankly, is like, you don't want to go to a person that is just going to give you the general overview. You want a comprehensive analysis and direction on how to improve what has been noted as poor functioning.
Yeah, it's like a lot of times when people come to me for nutrition, like, oh, what's the difference between a dietitian and a nutritionist? I'm like, well, one, do they have an actual degree in dietetics and nutrition? Two, do they have their credentials? Three, what level of experience do they have actually working in the field and doing these different things? Versus, hey, I went and got my nutrition certification over the weekend. I have no medical nutrition therapy experience. I've got no clinical experience and no real hands-on experience working with this environment. There's a clear difference, and there's going to be a clear level of expertise and value that person's going to be able to bring to you. And that's why a lot of times I'll tell people, or I'm sure it's the same for you. I've got my people on my phone that if I need somebody for an athlete or a tactical personnel that doesn't fit into, my expertise, hey, go talk to this guy, or this gal. Like they know way more than me. They specialize in this. Like they'll be able to help you when it comes to whatever the question may be.
Right.
So I guess when you're looking at labs, right? And can you explain to us a little bit more like low normal and high normal, right? When I guess should we be concerned for an individual with their labs? Is it if you see low normal, it's just like, hey, we need to watch out for this, and then we'll test you again and see if it then goes abnormal? Or are you saying like, hey, this is low normal, this is some common things that might be putting you in a position where it's causing you to shift this way. Here's some preemptive things that we can start implementing so that way you don't go in a deficient, low, or quote unquote abnormal range that's going to affect your performance or health.
Sure. Yeah. No, I think that's a great question, and that's something that we get pretty frequently. But again, it's really dependent upon the individual because it is subjective in its very nature. I have some men that come to me and, they're 60 years old. They have testosterone levels at 600, 650. They feel awful, right? I have some patients that come to me 18 years old. They have testosterone levels equivalent to that of like a 10-year-old boy, right? They have levels probably sub 200, sub 100 in some cases. But what I would consider healthy is in between the ranges of 500 to 700. I think that is not too bad. Now, what is considered optimal for most individuals, I think it's ranging anywhere from 600 to 1300. And you're going to have some bias on this based off of who you're speaking to, because again, it is subjective in its very nature. So I think that in my personal preference, if we're looking as far as what is considered optimal, I would put that within the ranges of 700 nanograms per deciliter to 1300 nanograms per deciliter. But anything outside of that 1300 range, I would consider that more so to be like a performance kind of dosing. So in that case, you might start to use that in performance enhancement. But when we're talking along the lines of bodybuilders, I can't tell you how many people that come in through our doors and they're like, I feel awful. I've looked into TRT. I think it's going to be a great option for me. And it might be recommended for them. And then one thing they always list off is, my fear is I don't want to look like Ronnie Coleman. I don't want to do this. I don't want to do that. I don't want to get too big. And it's so hard to understand that putting on muscle takes a lot. So much, not just an extra amount of an endogenous hormone, right? It takes food, work ethic, dedication, consistency, putting yourself into, quite frankly, a really, really dark hole in order to get to those top ranges, like these top bodybuilders. In no way are you ever going to get to that sort of physique off of a mediocre dose. You're not going to get to super physiological ranges.
Mm-hmm. And I guess, when you're working with bodybuilders, athletes, right? Or even let's say you're just collaborating and talk with another practitioner, we know there's going to be these, quote unquote ranges that we're going to get at LabCorp and these different places or the hospital, wherever it is, right? Where do practitioners and athletes find what an actual good optimal range is? Whether it's hormones, whether it's lipids, whether it's micronutrients, like where do people go to even find this information out in the first place? Obviously, Marek is going to be first and foremost, but there's obviously a lot of people that want to like self-educate themselves and just have a better knowledge. How do people equip themselves to know the difference when a lot of our lab levels and average levels are just so outdated or just can't be relatable to those higher activity or higher stress populations that we tend to work with.
Right. Well, again, and I hate to be so vague and kind of give you a blanketed answer, but it is subjective, right? What is ideal for me may not be ideal for you because we do have to take into account your biochemistry, your epigenetic predispositions, so on and so forth. But with that being said, it's really a matter of fact of wash, refine, repeat, because there is not too many providers, not too many practitioners that get so many eyes on blood work consistently with the correlation of the subjective data that's kind of engrossed in with the objective data that we're able to pull through. So, with that being said, is you might see and read 100 different labs in a day, but you're not getting behind the labs, which is the people, the individual themselves, and that's really where I think the fine line is for a lot of groups, providers, practitioners, even clinics alike, is that they start to treat numbers, not necessarily people, and what your symptoms are can be entirely subjective. Like I said, I've had patients that come to me even with a 600 level testosterone, 700 level testosterone, but have all the signs and symptoms of andropause or low endogenous production of testosterone. So what's really considered optimal, I would say, depends, but it's going to vary through different lab panels alike. So anything from a testosterone free in total, all of your sex hormones versus your lipids, there's different ranges for different subsets of different peoples, including different athletes. So it is a very diverse question, and I apologize I can't be a little bit more blunt because it really is entirely individualistic.
I can definitely relate because nutrition, or I mean, a lot of practitioners, right? You get that. What's the top three things I could do? What can I do for this? And
Yeah.
a lot of times their answer is it depends. It
Mm-hmm.
depends, and that's why, like you talked about, doing a full assessment or really diving in deep. A couple of things I think about is what is their lifestyle, what is their current behaviors, what is their past behaviors, what is their economic situation,
Mm-hmm.
what is their routine, what is their schedule, what is their family life like what is their stressors. There's just so many factors that you have to consider that, like you said, if you were just to pay attention to the number but not pay attention to everything, quote unquote, the roots of the person, then yeah, it may be
Right.
very hard to provide an appropriate prescription or idea or application of like what are those next to do steps, and until you can have the opportunity to find out who that person is.
Right, and I think a good start for any person is establishing the baseline, right? If we're looking at your health in terms of a spectrum, a very, very broad spectrum, we have to know where we are beginning at. That way we can see how our treatment has, uh, been, how effective it is, how efficacious it is, and what results we're able to gather and push down the line. So for anybody that comes here and they might have a laundry list of problems, we're of course going to begin our treatment establishing a stronger baseline. That way we can, in essence, cross all of our T's, dot all of our I's, hit a home run on the first hit, not have to go get poked more than we need to go get poked, and identify the abnormalities and deficiencies from day one. That way we can start addressing them and then compare and contrast baselines maybe every year to every other year. This might just look like doing a little bit more of an extensive panel. But something that has kind of been on my mind for years and years and years is why are teenagers not going to get lab work done when arguably that's one of the most monumental parts of their adult life? It's the onset of hormones, and how can we utilize this to our advantage? How can we feed our body appropriately? And these are the kind of things they're not teaching in school either. It's how to take care of your body, what to do, how to feed it, and this is kind of circling back into what you do as a dietitian. It's just we need to learn how to fuel our body properly. That way we can utilize it for the rest of our lives. It's a lot like driving a Mercedes Benz, right? You're not going to put 87 octane in it. And if you beat your car up, then your car's beat up. That's the only one you're ever going to get.
And I think, again, it also will be a little bit more challenging on the LS&T standpoint, but if you look at some of those higher organizations like the pros, some of the high college organizations, some information I've got is some of these teams are investing now in biomarkers because everything comes down to money, right? So if there's a select amount of biomarkers and you're not improving your health, or these biomarkers are saying that you're at a high risk for getting sick, getting hurt, why is that team going to invest millions of dollars of you if you're not even investing in yourself to take care of yourself, or you're not utilizing the practitioners that they're paying for to have around you on the team that are providing you guidance and advice to get yourself better? So, I mean, I've heard some chatter that like that's starting to become something that teams are looking at. And if you have great lab works and you're taking care of your body, hey, we're going to want to keep you around because we know that you're going to be able to last longer. We're going to get more value out of you. We're going to get more value on you being able to help participate, help the team. And, I've said this multiple times on my podcast, the ability to be available. The more available you are, the more you can contribute, whether it's a singular sport or whether it's a team sport, to be able to stay on the stage if you're a bodybuilder or be able to participate and play multiple downs for multiple years to help your team hopefully get to the ultimate goal.
Yeah, no, I completely agree. And to kind of expand on that just a little bit further, I think blood work really is possibly the lowest hanging fruit when you're coming in terms of performance, right? You're not training for a marathon, you're not training to be Mr. Olympia, but we can assess where we are now and get a good game plan based off of the baseline that we've established. So it really lays the groundwork for all continued treatment and all lifestyle, dietary, and pharmaceutical interventions and modifications.
Yeah, my motto is if you're not testing, you're guessing.
That's right.
You don't know what's going on internally. Someone could six-pack look fabulous on the outside, but if you don't know what's going on the inside, it could be a whole disaster brewing that you have no clue about until you actually look inside.
That's right. I love that. I'll have to use that sometime.
There you go. That'll be your key point in your next next chat you have with the client that's still a little bit stubborn. I guess what are some common labs then that you may recommend? I know, again, it's very individualized and it might depend on where you might tweak and have what labs here and there. But, let's say you're meeting with a bodybuilder or an athlete, like what is your go-to baseline stuff that you're saying like, hey, these are like what we have to get. And then after we kind of discuss that, then is maybe off of that, what is maybe some more particular labs you might get based off of gender or sport or bodybuilder?
Yeah, that's a really good question. Again, it depends for sure, but I would say to anybody that is coming in to get labs for your very first time, if you're just, gen pop, you've never had labs done, you've had to fight tooth and nail with your GP, your PCP to try to get your hormones tested, I would test over your general sex hormones, your testosterone, free and total. I can kind of explain the difference between those if you'd like. Sex hormone, bioglobulin, estradiol. And if you're a male, especially if you're considering wanting to have children, it would be most advised to test for your gonadotropins, your luteinizing and follicle stimulating hormones, and something I guess that I think should be included in all lab work, and generally it is for the most part. It's the two prerequisites that they'll look at in any kind of a hospital setting, which is your complete blood cell count and your complete metabolic panel. So the reason that I say those is because we can tell so much by so little. With the CMP, we can go over your kidney liver function, blood serum proteins, electrolytes, kidney filtration, kidney function, blood glucose, CBC, quality quantity thereof of all your red and white blood cells. The last thing that I would really recommend, and I think this is pretty standard procedure for most of Americans, is doing a hemoglobin A1C. So when you understand how red blood cells work is like they carry oxygen throughout the body. Everybody remembers that from your basic biology or anatomy and physiology classes. But something that isn't necessarily understood by Gen Pop is the half-life of the red blood cell. So it lasts like anywhere between 90 to 120 days. And a hemoglobin A1C is kind of a calculation that we're able to pull from that itself. So when you start to have excess amounts of blood glucose enter the bloodstream, you're going to have, again, elevated blood glucose. But when it lasts too long, it starts to become deleterious and affects the health of the red blood cell, in which case it would start to delineate that half-life, bringing that down. So we're able to kind of calculate the HA1C based off of the intervals that your blood glucose is spiking and dropping and how that's affecting your red blood cell as a half-life itself. So anywhere above 5.6 is considered a little bit pre-diabetic. Once it's above 6, I would consider you already within the diabetic range. But if it's under 6, even if it is at 6 or a little bit above, we can still reverse that. Now, with that being said, it's not going to be pharmaceutical intervention and, we just push everything down your throat and, send you on your way. No. It's got to take a lot of dedication, consistency, resiliency, a lot of self-monitoring and awareness over what you're feeding your body and at what times as well. So I'm sure that maybe you've already covered this, but implementing tools like carb cycling and utilizing different things to improve your insulin sensitivity and nutrient timing. So these are all kind of more advanced things that we would discuss at a later point in time, but this just goes to show that something so simple as an HA1C can elongate your life and improve your health and improve your physique in some certain cases, especially if it's way over the line. But when we start to utilize carbohydrates effectively and understand them as a way to fuel our muscle and fuel our body as opposed to just food, which I could get off on a whole tangent about how in America we consider calories, kilocalories, but over in Europe that it's considered energy, which I love the idea of that. It gives, not all people look at food as a fuel source. They look at it as an out or, some kind of a way that they can cope with whatever they've got going on. It's an escape. So I would say yeah, go ahead.
That's the two words I use all the time, because I like to do a lot of education. I'm like, remember 2 words for carbohydrates. It's fuel and energy. What do we need fuel and energy for? 1, with muscles, if you're doing something physical, right? Resistance training, endurance training, whatever the activity and training is. And guess what? You also, 25% of your glucose uptake goes to your brain. So when you're trying to do a very hard cognitive task, and in my case, in my personnel that I work with, right? Helicopter pilots. You're up in the air for, who knows, an hour and a half to 3 hours, and then you have a 2-hour debrief. That's a huge mental cognitive load. And if you're not getting the appropriate fuel for your brain to be able to keep locked in and focus, right? It ain't like missing a free throw shot. Yeah. Like that's a life and death situation. So, when we really get into talking about performance and energy and fuel, right? I really try to shift that verbiage away from, like you said, just thinking about calories and macros. And in reality, right, I know a lot of bodybuilders and certain personnel will definitely utilize those things because they might need to keep things fine-tuned. But there's a lot of times, like, I'm just using, photos and picture analysis to get people to figure out what their carbs and certain nutrients need to be, because in reality, like, calorie tracking and macro tracking for a lot of people is unsustainable and just super challenging to do on a day in, day out basis with all the other stuff they have going on in their schedule.
No, I completely understand. And, I think that's kind of an origin story that needs to be rectified in America. It's how to really feed your body and what exactly is food. I took nutrition as like a 7th grader in middle school, and I can't tell you anything that I really took from that class. Everything that I learned about nutrition, I gathered from the internet. And it was really about, first, something a little bit more, um, I would say, physique related goal, aspirations, things like that. A little bit more vain type of things. But as you continue down the line, it's like we all want to look better. We all want to look our best. But then you start to get into, I want to feel my best and I want to live longer and I don't want to have joint pain and I want to run with my grandchildren. And that's
Yep.
really where the short term versus long term goals come in. And that's why it's so important to have that baseline that I was speaking about earlier.
Yeah. And so, and just to go back, so you mentioned, H1C, my practitioners I was under during my clinicals used to be the funniest because they said, "Oh, that's our no bullshit meter." If a diabetic comes in and says, "Oh, they've been eating good, they haven't been eating a lot of added sugars or simple sugar foods," they go, "We're going to know really quickly about the glucose and what their H1C looks."
Yeah.
But that shit is like, they go, "We 100% know you're not following or listening to the recommendations you're telling us because the numbers don't lie at the end of the day."
It's pretty wild, and I've seen some pretty obscure things that you just wouldn't really think of when I was reviewing lab work. Even today, for instance, I had a patient that came in. His HA1C was at 5.8. He had blood glucose at 102, but his fasting insulin was at 2.6. And it's like, what exactly is going on here? You have a high HA1C, you're insulin sensitive, but you have a high blood glucose. Could it be a testing error? And these are some of the things that we kind of need to work through. And it's also awesome because there are times, I don't care who you are, this is an ever-evolving understanding. Because in essence, we are kind of conducting citizen science, especially by collecting data, comparing and contrasting subjective and objective data. But this is something that we're still trying to find and correlate what is the most optimal. And again, because it's subjective, I don't know that we'll ever reach that point. But how cool is it that we get to participate in understanding at a molecular level what we can do about improving our biochemistry and manipulating it in the best of ways.
Now, going back to obviously high glucose, high H1AC, would you recommend walking directly after meals as a method to help with insulin sensitivity amongst many
Yeah.
methods?
Yeah, I think postprandial walks are extremely beneficial. It's going to help digestion. It's going to help move your whole digestive tract around, help churn that food, but it's also going to help kind of stabilize blood glucose after the meal itself. So we won't get that big spike in the blood glucose, which may lead, if it's a consistent choice, to a higher HA1C. We don't want that. So by doing the postprandial walks, we're kind of able to combat that.
Okay. And then I know carb cycling you can go into a huge talk on, but maybe give us like the Cliff Notes version. 'Cause I'm sure people have tried to do carb cycling, but don't quite know what that means or what that looks like or how you appropriately do that. So maybe some tips or ideas on like how you would move forward with doing something like that if that's something someone was going to try or utilize.
Yeah, I think that's very, very beneficial. And of course, it's something that can be utilized, but I think it has a time and a place for it. So I would more or less consider doing carb cycling when I'm in a hypertrophy phase or a mass gaining phase. The reason that I say that is because you have the ability to rapidly grow different portions of the body that seem to be lagging. So let's say, for instance, I had my personal goal in growing a bigger chest. On the day that I hit chest, I'm going to increase my carbohydrate expenditure for that particular lift. Because of this, I'm able to fuel the muscle and I'm able to have more output from the muscle itself. Now, I think the rule that a lot of people kind of negate is the stabilization that comes with having your protein and your fats. So we have to first understand what macronutrient does what. protein helps repair the muscle, carbohydrates help fuel the muscle, and fats will help stabilize hormones. So we don't want our protein and our fats to really go anywhere. We just want to manipulate the carbohydrate based off the day of the week and the corresponding body part that we are wanting to elicit a growth response. So what I've done historically is I will implement different carbohydrates. I try to stick to more whole foods, but in certain growth phases of my bodybuilding journey, I have pushed in excess of like 800 to 900 grams of carbohydrates a day. And that is very, very, very hard to do in terms of eating very, very clean. So it got to a point for me when I was really, really in this pushing phase, kind of nearing the end of it, I would say, I ate things like Sour Patch Kids or even Pop-Tarts. Now, the reason that I did that is because the sugar that is within both of them is more readily available, and they have low concentrations of both protein and fat. So we want that blood glucose to be immediately used. And I think that there is a certain bandwidth of, cognitive function too, especially when you're putting so much stress on your body. And this is where the humanity comes into play with bodybuilding as well, is that having the little things that you really enjoy within your routine. I fell in love with chocolate chip Pop-Tarts. I don't eat Pop-Tarts. I love it in that season because it allowed me to kind of have a break from the monotony of the traditional bodybuilding meals. The coconut oil and the rice and the beef and the chicken and the broccoli. It gave me something to look forward to. So I think that by implementing a different variety of whole foods, and then maybe having, if you ever get to that point where your cortisol's through the roof, you're stressed out, having something that you can look forward to, as small as a Pop-Tart a day, really helps. And that's something that I think has a physiological response because it has such a high cognitive response in decreasing, your stress hormone, your cortisol. So that's really the really interesting part about why we do what we do too, is that you have a lot of people, not just through Marek, but in this general atmosphere that have competed, whether that be in a bodybuilding show or they're multi-sport or they've done fitness modeling or X or Y or Z. It's like you're not going to take advice from a guy that doesn't know where to go where you want, right? So I'm not going to take directions from any Joe Schmo, right? I'm going to take directions from Christopher Columbus. Just humor me. That's kind of the whole idea of the thing. It's like we want to trust in the advice that we're receiving because we know that it's been given from somebody who's experienced and has walked that walk before. And when it really comes down to people dieting, I've even told patients, I'm like, listen, I've been so lean before that I can't walk barefoot. I don't have any padding on my heels. And that's a different kind of suffer. Right, that's a different kind of suffer that you don't get anywhere else. So, it's very multifaceted.
And to go off a couple of your points there, I mean, even like if you look at Nathan Payton, who works with multiple, World's Strongest Man winners, he's very famous for the Rice Krispie treat around training. Or you got someone like Stan Efferdine who heavily implements white rice. Or even, chatting with Nathan a little bit, on Instagram, talking about, guys got to get more calories in. Hey, I'm doing a white rice. I'm doing a mashed potato versus a regular potato. Maybe I'm doing a white bread. Maybe I'm telling him to eat a Rice Krispie because, in general, whether it's a strong man, whether it's an athlete, some of these guys' caloric intake needs are just so high to be able to sustain either the muscle mass or the rigors of the training that they have to do, that if you're not implementing some kind of process or simple carbohydrate, which again, like you said, has lower fiber, protein, and healthy fats, sometimes we have to include those just to be able to even cut even or be able to get a surplus that we need because of the quantity of calories or energy or fuel intake that is needed to do those things.
Yeah. It's pretty cool getting to see how, again, and how I kind of started this whole conversation is how responsive your body is and how you learn from that based off of the objective data you're able to gather from lab work too. Because I have labs from every season, whether it be a month out for my show to a year before I even started prep, and everything in between is I'm able to see, okay, where did I begin? What did my diet do? Because with bodybuilding and with many athletes alike, variables are very constant, which means that every patient, in essence, that is a hardcore athlete can essentially be considered a case study dependent upon their ability to be regimented, because then all variables really are controlled as much as they can be for the human experience.
And I like what you said there. And I do this a lot with private the athletes I used to work with, the place I was, and also where I'm currently at, is, when we're testing and getting data, like, this provides us a macro level view, right? Like, if I'm going to do body comp 3 to 4 times a year, or I'm going to do a pre and post nutrition assessment, right? And then you have this season, you have this show that's coming up, you have this, in our case, undergraduate pilot training. Now, as I'm getting these multiple tests throughout the year, I'm able to get a macro level view to see, where did you do an amazing job? Training was spot on, fueling was spot on, put on more lean muscle tissue, felt really good, high energy, performed at a high level, versus, hey, your schedule changed, your routine changed, your fueling and your training wasn't as good or as optimal as it could be. And when you can lay that all out to them, in front of their eyes, and they can see that, the buy-in is so much higher, and they can actually see, like, okay, I see now going into my next year, season, whatever it is, where I need to work and get better. Which, when you can now progress forward versus having to go in that cycle and just keep doing the wrong thing over and over because you're not tracking and you don't know what's going wrong. I feel like that's just so common. You see all the time. People just don't want to take the time to track a little bit. You're just going in circles, and you're never really progressing in the direction you want to.
Mm-hmm. No, I completely agree. And that's the thing. It's like, you have to have a goal. If not, you just kind of wander around aimlessly. And by assessing your biochemistry, we're able to get that goal. And you may have, vain goals. I want to look like this. I had a patient the other day. He's like, I want to look like Johnny Bravo with the full head of hair, and it wants to be big and muscle bound and things along this line. I'm like, that's awesome. That's a great goal to have, but we're not going to get there until we get these low hanging fruits and start to improve these particular panels and these particular segments within the panels themselves. So, baby step approach, but we can't make changes overnight and just throw the whole bucket of things at you, because then we won't have an understanding of what's doing what. We need to slowly implement variables over time, similar way that you would to, creating a person's diet from the ground up.
Yeah, I always like to tell people and be upfront and honest. Like, and I also like to say, like, hey, you want to be this person, but let's be realistic too. Like, you are not that person. Like, you got to be the best you. So you got to realize, like, and like you said, let's take care of the low-hanging fruit. Let's set the foundation. Let's progress from there. But I always like to tell people, like, I don't want to get your hopes up. Like, you may never look exactly like that person. Yeah. And are you going to be okay if you don't look like that person, or are you going to constantly be in a position where you're disappointed because you can't look like these people you see on social media? And that's a whole tangent I can get into, but I think a lot of times we always try to compare ourselves to people. It's like you said, everyone's so individually different. Like, you can never look 100% like another person. Just try to be the best you at the end of the day.
Yeah, absolutely. Yeah, you can eat the same, train the same, take the same, and look completely different just based off of your genetic makeup alone. But that's why treatment is individualized and it's catered to the individual themselves. So it's important finding a good clinic as well, and good, trustworthy, reliable sources in which they've learned from, because there are several ways to operate this. You can treat people as patients, or you can treat people as numbers. People that treat you as numbers, well, then they're only after your numbers draining in your bank account. So I think
No,
that
no.
yeah, there's a lot of people in this industry that just I'm going to be prescribed 200 milligrams of testosterone and 1 milligram of anastrozole and send me on my way. And then time after time again, we get these patients. They messed me up. I don't know what's going on. Fix me. And all it takes is a little bit of individualization and empathy, because these people really do suffer to an extent if the care is in the wrong hands.
Yeah, a lot of time it's unfortunate, especially depending on the economic level or the area they are in the country. That care differs all over the place. But
Yeah.
my another saying you might like, and this comes from one of my colleagues that used to work. He's a mental conditioning coach, and a lot of time with a lot of these athletes, especially these 4 or 5 star athletes, you gotta use verbiage and things that they can compare to
Mm-hmm.
that makes sense to them. And his big thing used to be, you can either invest in me now, or you're gonna overpay later. And if you overpay later, I can't guarantee
Yep.
you that you're gonna be in a better spot, or you might be in a worse spot
Mm-hmm.
trying to figure out stuff that you could figure out right now.
Yep. Yep. I love that. I might have
Um,
to write that down.
there you go. We got two for your day. Two for two Tuesdays. No. um, One last little thing on carbohydrates. So you obviously mentioned, and I kind of coined that in the nutrition world. Nutrient periodization is a pretty common term that we use. But
Mm.
obviously, you're increasing carbohydrates on those super high training days to really saturate the muscle and provide enough fuel that you need so you can help with the growth and tissue repair. So, but let's say you have 2 training days in a row, and let's say it's Wednesday, you're going on a low, like an off day slash recovery day. Are you then significantly dropping the carbohydrates there on that day slash or your recovery days, or are you still saturating the muscle so that it's prepared for the next training day? That's always a question I get where people are kind of in between, like what to do. I think of it as you're
Yeah.
using less energy, so you need to like
Mm.
manipulate and increase either protein and fat or sustain those, and then kind of cut down on the carbs a little bit, then ramp them back up the next day. But would love to hear your opinion on that.
Well, I think that's I think that is the right approach, but ultimately, I think that it depends upon which season that you're in, whether you are in a massing phase or a cutting phase, whether you're in a caloric surplus or a caloric deficit. If you're in a caloric deficit, carbohydrates would be lower. In some cases, depending on how lean you currently are, fats may come up just a slight. Protein pretty much remains consistent. Now, if we're in a caloric surplus, if you were on that rest day, let's say that you demolished legs the day before and it was your high day, and you were noticing that maybe your weight dropped, maybe you are extra sore, maybe you're recognizing based off of your general awareness that you might need to have an extra recovery day. In which case, like I said, everything really is subjective in nature, and we would need to take into account where their mindset is, where their physical needs really are. Are they advancing in their weight? Are they advancing in the progression of their lifts? If so, maybe we implement and increase excess carbohydrates intermittently, right? Maybe in just a meal or two, maybe not throughout the entire day. So we are still in a little bit of a caloric surplus, but not as much so. So it's really hard to say, but I would say it would be dependent upon being in a restriction or being in a surplus. Does that make sense?
Yeah, so highly dependent on the individual's goals at the time and what they're trying to get out of it will depend on how you're going to curtail or shift
Right, right. So,
those
I mean,
numbers or portions.
I'm just kind of recognizing I did not cover the medium and the low days on the carb cycling that we talked about earlier. But yeah, you've just kind of covered the whole forte. So
There you go.
thanks.
Do you try to keep like protein like 1.6 to 2.2 grams per kilogram typically?
Um, I would say anywhere between zero point 0.8 to 1.2 grams per pound of body weight. I believe that's equivalent to what you just said in USA weight. With that being said, I always eat just a little bit in excess of what my body weight is per pound of lean muscle. So right now, like I'm 5'9", I weigh around 225, and I'm not going to be intaking 300 grams of protein a day. There may be a point in my time in life that it was probably nearing that, right, when I was doing my bodybuilding shows and things like that. But generally, I'll eat maybe 10, 15 grams excess my body weight. So maybe around 240 grams on some days. But my goals have changed drastically. So right now, I'm even trying to find what is the healthy feel for me, right? Transitioning from bodybuilding to marathon running is not for the faint of heart, but it is entirely different in terms of nutritional needs. And
It's a
physical.
your life.
I'll tell you what, my joints right now are so beaten up, but I'm able to almost think a little bit more clearly now. Maybe that's just because my VO2 max has increased, could be from various different things, but it is a nice change of scenery, and it's a nice, mentally challenging goal. I think running is much harder than lifting.
And I love that point you made. I think nowadays people are almost like having to go out to find things that are mentally or physically more challenging because too many things are too easy or just given versus how it used to be like in, let's say, the 60s, 70s days where you actually had to really go out and work a hard 8 to 10 hour day, where nowadays people are just chilling, comfortable, playing video games and on their phone.
Yeah. It's difficult everything's so readily available now, and a lot of people grow ever more impatient because they want this idealized self and they want it now. But that's the thing about bodybuilding and a really good physique and somebody who's really taking good care of themselves. You can really see who's invested into their health by the time they're 35 years old versus somebody that completely hasn't. I know people that go out to the bars every single weekend, they smoke cigarettes, and quite frankly, they look like a baseball glove. Then I have some people that I've seen, that even patients that are in their 40s or 50s, they don't look a day over 30. And I don't mean that in like a vain way. I mean, I was shocked about how young they actually look because they've emphasized their health over many different things. And I think when you get to the point where you're 50 years old, you don't say, oh, I wish I would have drank more in college, or I wish I would have done more drugs, or, smoked more cigarettes. It's always like, I wish I would have taken better care of myself. So.
Woulda, coulda, shoulda. All you can do is what you can do right now. You can't take back what you did before.
Mm-hmm. Very well spoken. Yes.
Yeah. So that's the one thing I wanted to dive into, and especially males, and it can also go into females too. Is we hear a lot about free testosterone, total testosterone, but can you tell us a little bit more SHBG, LH, FSH?
Sure.
How does it affect hormones? How is that communicating from the thyroid in our brain down to our testicles, then producing the appropriate amount, and then when those are abnormal, like what does that mean, and like what do we do as males in that situation? I think a lot of times the mainstream is go to the clinic and get TRT, but it's like, well, are you really figuring out like what you could be doing to try to improve or fix that versus like automatically thinking you have to go and get TRT treatment right off the bat?
Right. So I think it's a lot easier understood when you kind of put this into the means of metaphor. When I look at testosterone total, and I'm explaining it to someone who's Gen Pop, who has no idea of the difference between testosterone free and testosterone total, I say, listen, let's look at our body like it's Mercedes Benz, right? When we go and fill up that car, we're going to put 93 octane in it. We're not going to put 87 octane in it. If we put 87 octane, we put the cheap gas and the cheap fuel in it, we're going to get cheap output. We're going to maybe lose horsepower. We're going to have to go get more frequent oil changes. We're going to start to run into some engine trouble. There might be a couple knocks that we have to deal with. However, when we put 93 octane in your car, we're going to get the best results. Minimal maintenance, more longevity in the car, a more comfortable ride. Now, if we stick with this car metaphor, we really have to look at testosterone free and total. So what is the differentiation between the two? Testosterone total, let's think of this as how much fuel you have within your car's gas tank, right? It's where the needle falls between empty and full. So let's say that, for instance, looking at LabCorp reference intervals, 916 nanograms per deciliter is the end of the average reference range. So let's think of that as the sticker that comes on the car, right? That is what our car is rated to get. Now, if you have a reference range of, let's say, 700 nanograms per deciliter, that means that we probably have over 3/4 of a tank of gas. That's not too bad, especially for somebody that could be like a 35, 40-year-old male. That's a pretty good testosterone level. I wouldn't have any problem with that, even for myself. Now, when we look at testosterone free, we have to look at this in terms of our fuel economy or our gas mileage. Now, we can have a full tank of gas, but we can have poor functioning gas mileage. So this is our utilization rate of testosterone. This is how I have a lot of my patients really think about this, because putting it into a metaphor makes this very easily understood. Okay, so what we can do, similar to a car, and we do modifications to the engine, we get a better output, we can get more torque, more horsepower, better fuel economy, increased towing capacity. We can do the same things with our body through manipulation of certain nutraceuticals, certain lifestyle implications, even some pharmaceutical interventions. So what we want to do ideally is we want to have a full tank of gas, and we also want to have the top gas mileage that we possibly can. Now, similar to the way that you can modify a car and its engine and its output, you can do the same thing with your body. So we can go beyond these recommended window sticker reference ranges, in essence. So we can get our testosterone up to 12 or 1300. We can get our free testosterone past 23 or 26 or 30. We can increase our fuel economy. We can increase our utilization rate and increase our total fuel capacity. So with that being said, how do we get those increased amounts? Well, if we're looking at our testosterone free and total, we have to look, so too, at using the metaphor, speaking of the car terminology, ways that we can upregulate our androgenic receptor and androgenic density. So if you go to an AutoZone or an O'Reilly Auto Parts, you can go get these things that you put into your gas tank. Helps clean out the fuel, helps clean out some of the lines, gives you a little bit better gas mileage. I can't remember exactly what they're called, but overall, it's going to help your car run better. It's part of the general maintenance you should do to most vehicles. Maybe not high-performance sports cars, but Gen Pop vehicles. So with that being said, we can upregulate our androgenic receptor. We can upregulate androgenic density by including things like L-carnitine, which is a base amino acid. But what it does is it also helps convert stored up energy and utilize that more effectively as something that has become more readily to use. So we can take stored fat and convert that into energy, which is why you see a lot of endurance athletes or a lot of bodybuilders even take it in high frequencies and high amounts because it has this specific purpose. Now, the other thing that we can do is we can upregulate androgenic density. And, up in the early 2000s, you saw the commercials of the old man laying in the bathtub holding hands with his fiance or wife in another bathtub overlooking the ocean. And it said Cialis or Viagra. And, you're sitting there and you're like, what is this? Like, what does this have to do with anything? And it's tadalafil. It's sildenafil. And basically what that does is it helps improve androgenic receptivity, androgenic density, but it also helps improve overall blood flow. So you get the sexual benefits to it, but you also get the increase in the susceptibility, the utilization rate of the testosterone. So that was a lot to throw at you, and I'm going to kind of expand on that idea. Are you with me, Sean?
Yes.
Okay.
Keep going.
Then we have to ask
I'm
ourselves.
with you.
Right. I know you are. Okay. So then we have to ask ourselves, okay, so what about endogenous testosterone production? Like, where is that coming from? Well, your body has something called gonadotropins, which is otherwise known as your luteinizing and your follicle stimulating hormone. These are released by the pituitary gland, and they communicate with the testicles. Luteinizing hormone and follicle stimulating hormone are directly responsible for testosterone utilization, secretion, spermatogenesis, sperm motility, and mobility. So it's the fertility hormone, and we can manipulate certain things through things like human chorionic gonadotropin, which is a luteinizing hormone, a mimetic agent, and then we have enclomiphene citrate, or Clomid, as something that used to be commonly prescribed about a decade ago, that helps stimulate both follicle stimulating hormone and luteinizing hormone. Now, what essentially these medications do is they trick your body into saying, hey, I'm producing too much estrogen, and I need extra help from the boys. I need some extra guns from the testicles. So essentially our brain receives these signals as, hey, the body's producing too much estrogen. This is the male body. This is too much estrogen for a male body. We have to up-regulate and increase our testosterone. So we can implement these things in like a fertility protocol. I'm kind of getting off track there. So that's the luteinizing and follicle stimulating hormone. The last one that you asked about was the sex hormone binding globulin. So when I explain this to somebody, I describe it as the transport mechanism for all of your sex hormones. But for the layman's terms, I really try to articulate this in a way of something that's very easily understood. So what I say is we have to look at the SHBG like it's a school bus. Why a school bus? Because we must think of hormones as though they're little children, right? You don't want to leave a child left unattended. They're going to get run over by a car, or someone's going to kidnap them. And kids are they're just hard to control, right? So the SHBG is essentially the school bus that comes to pick these kids up at the bus stop, takes them to school, lets them do their job, and then takes them back home. Oftentimes, we kind of run into this whole idea of, do we have too many children and not enough school buses, or do we have too many school buses and not enough children? So there is, and this is kind of debated amongst even clinical research too, but the higher your testosterone goes, especially when you're taking testosterone replacement therapy, oftentimes we'll see a drop in the SHBG. Maybe it's because we're filling up all the seats of the buses, ergo we don't need as many bus seats, right? We don't need as many quantity of the bus itself because it's more efficacious to take 4 or 5 buses and haul all the children off at once. Or we have too many school buses and not enough children. And this is where we would implement something like boron, which would help increase testosterone free in total by bringing down the SHBG, which allows more butts to be in seats. So that was very long-winded, but this is how I try to describe most lab work to patients, is that it doesn't have to be all of these medical terminology. It's very simple processes that can be articulated in a very there's a lot of people that go on podcasts talking about this stuff and try to overcomplicate the simple things. But really, when you understand the basis of it, it is fairly simple. It's just translating that to somebody who's not in this space.
And I think the best practitioners are the ones that are able to take extremely complicated, super sciencey information and dumb it down to a second and third grade level that it doesn't matter who's ever is in the room. Everyone can understand what they're talking about. And I like that you use several different metaphors. Shout out to Kaylin Buffalino and Brent Hurd. Two people, if you don't know who they are, definitely check them out on social media. Kaylin is a communications expert, but one of the things she taught me was using metaphors and storytelling is extremely powerful because that may be the one thing, the story, the metaphor that you use is what's going to help
Right.
allow that person to remember what you were talking about, maybe even out of this whole entire talk that we do. They remember the school bus talk. And if they
Mm-hmm.
remember the school bus talk, and then they can then relate and then translate that information to store that in the long-term memory to then know what that then translates and over to means, boom, you've been able to make a connection that they can now remember and recall at a later time, which
Yeah.
isn't always easy for people to do when they're trying to explain some of these very complex, especially
Right.
down and upstream and hormonal things and what each organ does. It can get super complex. You can get in the weeds really fast.
Mm-hmm. No, I completely agree. And, I'm from Southern Indiana. And, while we're not considered like the deep South, we're in the Midwest, we're in the South Midwest, which is arguably a very different culture from a lot of the world. You'll bump into people at supermarket, they'll go, oh, I'm sorry. Oh, didn't see you there. But it's something that you understand within some of the rural communities is they speak a lot with metaphors. And what's understood doesn't have to be explained. And I think that people go about explaining things in a way that negates it having to be understood. And that's kind of what we speak in as far as like Midwesterners to each other. For example, if you say, "Man, I've got a lot of things to do today," I'm like, "Yeah, you got more stuff to do than Quakers got oats." Right? It's things that add it's things that add like a little bit of that southern charm, but it's like I see what you did there,
Yep.
and now I understand exactly what you mean.
Yes, that's a funny one too. But yeah, any of those little nuances, funny things that make you laugh, things that cause that memory to occur, like it's gonna stick like Elmer's glue at the end of the day. See what I did
Right.
there?
Yes.
um,
Yes, I like it. You're picking up on it, Sean.
a couple things I want to touch on that you mentioned within that whole thing. You mentioned like CFO for like blood flow. Do you ever recommend nitrates, beet powder, 2 before, which has black currants, flavored naturals,
Mhm.
something different that's also come on the market with cocoa flavanols. Each of these obviously work in several different ways, but to get to the ultimate goal, which is producing nitric oxide to increase blood flow, have you ever utilized those options from a food slash supplement option before you transition to a medication?
I think it's got a time and a place. Obviously, if somebody has a particular preference against, pharmaceuticals, because Cialis is considered, tadalafil is considered a pharmaceutical. We may consider like the beet powder and things like that, but I've tried a lot of these things, and I think there's some really good supplement companies out there too that have nitric oxide, blood volumizers, things like that that can be utilized. Again, time and place for it. But I've even had my own personal hand in the beetroot powder. I used to run like half marathons and stuff like that when I was younger, and I was about 100 pounds lighter. So I did the beetroot juice before one of my races in high school, and I spent half of it just throwing it. And it is the most god awful, worst tasting thing ever. I would much rather take a dissolvable tablet that tastes like oranges than that. So that's my preference.
Gotcha. You also mentioned boron, other things that kind of popped to my mind from a lifestyle change or micronutrient standpoint. Any comments on effects on testosterone, free testosterone with magnesium, vitamin D, omega 3s, Tinkat Ali, any of
Mm.
those things you're seeing as other implementation you would use in this
Yeah,
sense, or any other
yeah,
lifestyle changes more so than a
yeah.
pharmaceutical use to help with
I
getting those
think
levels?
yeah, vitamin D is I would put that up there in probably one of the top 10 panels that you should probably be testing for. I don't have an actual statistic for you, but I would say, based off of what I'm seeing, at least 60% of men are deficient in vitamin D, and that is a precursor, and it's very, very important for neuro health, especially to counterbalance depression during, winter seasons and things like that, especially for our folks up north. Now, in regard to, Tongata Lee, there's some really great products. I've seen some people's labs, they've just been exponential responders where they're not taking enclomiphene, they're not taking tadalafil, they're not taking L-carnitine. They're simply just taking something like Gorilla Mind. It's got a supplement called Sigma, and I've seen levels supersede 1,000 for total testosterone. So do I think that it is for everybody? No. Do I think that it could be worth trying and testing and seeing if you are one of the individuals that could have a slight response with that? Yeah, of course. I think for most populations, though, we might not see, but maybe like maybe 50 to 150 point increase on average, which still, if you're at 600 nanograms a deciliter, that extra 150 nanograms boost would put you with what I would consider the optimal level. Now things like magnesium, of course. I think that's the big supplement that's kind of, for lack of a better word, being like a fad right now. It's a lot of people are recognizing like, hey, I've been deficient in this my whole life, and all of a sudden it's helping bring down my anxiety, it's helping improve my sleep, so on and so forth. Now, the thing that I would steer clear, or at least try to educate yourself on, is the differences between the magnesium itself. I have so many patients that come to me and they're like, hey, right. They come to me, they're like, hey, I've been taking magnesium and I don't feel any better. Like, what kind is it? They're like, magnesium citrate. And I'm like, are you holding down on the toilet a lot? Are you always on the toilet? They're like, how did you know? I'm like, yeah, that's going to cause that. You need to be taking like glycinate or threonate or something along those lines, not the citrate. So,
what about any comments on ashwagandha or herb, or like obviously Tingali is also herbal as well. I think some of those things are also kind of, I don't want to say they're coming a fad, but they're coming around. Obviously, sometimes those herbals could be almost demonized because maybe the research and or safety testing of supplements isn't always on par in comparison to your typical like omega-3, vitamin D, things that are NSF certified, informed choice, especially for athletes that have to take something that they don't want to risk popping negative or positive test on or affecting their health. Any comments kind of on that realm?
Yeah, well, in regard to the ashwagandha, COVID really did a whirl because I saw, through various social media channels that ashwagandha was just being blown up out of proportion. People were eating handfuls of gummies and saying that they got like numbed out to a certain extent, like they almost got to a point of like just not caring about anything. They lost all drive, or they had like a shunt in their emotional capacity too, which I don't think any emotions at all is just as unhealthy as too many emotions, right? We need to have equanimity. We need to have not too many highs or too many lows, kind of somewhere in between. But I think that there is some truth to it, but I think with all supplements alike, and this is coming from somebody that, like, I worked in the supplement industry, I've had nutrition stores, I've helped formulate products for certain people, things, companies, places. So with that being said, it really depends upon the origin and the source that you're getting these raw ingredients from. I've been to factories where they will compound, in essence, these supplements, and I will see where they get their raws from. And the difference between XYZ in Texas versus XYZ in New York, just using those kind of as, examples. But you really want to get something that's high quality, because a lot of times things can be broken down within your gut, especially on the compound itself, before it can even be absorbed and utilized properly. With that being said, working with somebody that's efficacious, that the purity ratings, the testing standards, and somebody that abides by that. I have people, I've seen supplement companies kind of on the back end of things that have only gotten like a 60%, 60% of what they thought was going into the supplement was actually the supplement that they ordered, right? The excess was just filler ingredients. So when you're going in toward of like athletic supplements, like I've got my brands that I typically stick to, and I'm happy to recommend those. But when you're going for like health supplements, I would recommend really two companies in particular, and they cover such a large array of different categories, and that would be Designs for Health and Thorne. I think those are two very acceptable companies.
And that's hilarious, because my top five that I always recommend is those two, Clean, Momentous, or a newer company that just come out called OAIM. Or I have a couple other companies, maybe like a Pure Encapsulations or Transplant Labs, that maybe not NSF certified, but two other companies that, if there's other things that maybe some of those brands may not cover, they have a wider selection. I may go over to those two, but Thorne.
Yeah, all the things that you just mentioned are
they're good quality across the board.
Right. Yes, I agree with you. You just mentioned some other really great companies as well. But really, it's just like people kind of generally have like a little bit of a bias too when they use a company for long enough. They're tried and true, and they're not going to change. But try your hand, because certain companies formulate things in a different way. They source their ingredients from a different facility, a different country, and ultimately it's the quality that matters the most.
I guess, how do you control that then? Right? Is it you have to go do your own investigation and see where these things are coming from, or you just gotta trust that it's going to be good, or you're doing your own testing when it comes to your manufacturing plant and having these third-party organizations come in and test? I guess it seems like that could be a whole challenge of its own.
Yeah, no, I agree. I think that each company is different. There are some companies that would send you like a purity report, in essence. There's other companies that would never even touch that. But there are third-party testers that you can go to. They may be throughout your region, and you might have to pay out of your own pocket to get them tested. But that would be something that I may consider, especially for somebody that is ordering like a large quantity, because you want to make sure that what you're buying is really what you're getting, and kind of pick from the bunch of which ones fit you best.
Gotcha. Shifting back to like who to test and when to test, when you're working with all sorts of different groups, like a bodybuilder, a gym pop, a athlete, right? Do you tend to change the type of biomarker testing you do based off the specific population group that you work with, because each may have different physical or mental stressors that could cause certain abnormalities, or does it still come back to like it depends?
That's it would depend on their personal goal and where they're at in life, because obviously, if somebody's coming to us and they're in pain and they want to try treatment, but they can only afford a select amount, then we have to be very frugal with the way that we implement our methodologies, right? We have to take things very slow and kind of get the lowest hanging fruit and see if once we got a positive snowball effect rolling, what that snowball is going to collect and what other things may be rectified as a result of down regulatory factors.
Hmm. Okay. Is well, I want to do this question. What are maybe like, because you've probably seen hundreds of thousands of labs, right? What are maybe some of the most common abnormalities, deficiencies, and low levels that you just see chronically all the time that maybe people listening to this episode could take from that? Like, all right, well, you mentioned vitamin D. Like, maybe I should just supplement with vitamin D because if I don't get enough sunlight, I don't get enough dairy products. Like, that's inevitable. Like, is there any of those like trends that you just see over and over and over again, that people should just be aware of, or maybe just automatically get tested because there's probably going to be a high chance that there's going to be an issue, even with eating the highest quality foods and choices?
Yeah, well, when it comes down to testing for micronutrients, there are specific panels that I would run. It's called like a comprehensive micronutrient and mineral panel, and that's not too commonly ordered, though I would recommend it, once or twice a year. Some patients are a little bit more reluctant, especially the ones that really have their diet nailed out, but in some particular cases, I would recommend it to people that have been eating poorly for quite some time, and we need to assess what are the immediate improvements that we need to see in their diet. And something that I see in people that are classically overweight is usually like a selenium or an iodine deficiency, which can go hand in hand with hypothyroidism or Hashimoto's disorder. It could also coincide with low vitamin D levels, vitamin A levels, even potentially vitamin E levels. So the thyroid's a little bit tricky because it does take all these different, what's noted as cofactors that helps the T4, the inactive thyroid hormone, to convert into the active thyroid hormone T3. And it's very tough to get dialed in with certain people, but that's also why it's incredibly useful to work with a compounding pharmacy, because some people may take specific amounts of Synthroid, or they might be able to get by on a natural desiccated thyroid or a porcine thyroid. So I guess to answer your question, iodine, selenium would be big ones. Vitamin D would be a really big one. And then I would like to see where vitamin B12 is. Carnivore diets become a little bit more of a trend as well. Maybe we're kind of at the end point because, the Liver King, what happened to him, and the carnivore MD, I can't remember his name, Salvatore, I think. He recently talked about how he thought carnivore was initially the greatest thing ever, but he's saying now that it was not a long-term thing, which is what all people I thought were kind of on the premise of. So B12 to bring down homocysteine would also be one that I would consider as well.
And do you see, I guess, depending on ethnic groups, that homocysteine seems to be higher in different groups? Like one trend I was chronically seeing in the last group that I worked with was 90% were vitamin D deficient, and homocysteines were like through the roof, like 11 to 20, and not just like a couple people, but across the board. And most of that athlete population I was working was African American. And I know there's obviously a methylation component genetically that can be a challenge. Or one of the sports pharmacologists I worked with said there could be like a 40 to 50% chance where most Americans or most people have a hard time methylating B vitamins. I guess any insight on that? That was always something that really intrigued me, that I wanted to what does this mean?
Yeah,
Or am I trying to see what I think I'm seeing?
right. That's where this whole new segment of epigenetic testing and predispositions kind of comes into. Everybody's heard of Gary Brecka, the 10X Health guy. What he really focuses on is a test called MTHFR. And Other
Yep.
people call it the MFR gene because it's a lot easier understood than that because it can be. It's an MFR. I mean, if you have this MTHFR gene variation, your body cannot methylate certain vitamins, and it can cause early onset depression. It can exacerbate signs and symptoms of anxiety. And if you have an epigenetic predisposition or a family history of bipolar disorder or schizophrenia, it can potentially worsen these things. And to some extent, maybe even impose them on you. Now, as far as MTHFR testing, that is something that I've done, I've seen, I've helped people with and through. But really, I think that we can negate the use for it altogether by supplementing with a methylated B vitamin complex. But the kick in the pants is that you look on a box of cereal and you look at Pop-Tarts or, a lot of these processed foods. What they're
not methylated.
Right. It's not methylated B vitamins that they're including into it. So is this whole thing that we have in today's modern society, is it from a nutritional deficiency? Are we putting in things that our body really can't process? Is it the chicken or the egg? Is it environmental or is it hereditary? It's really hard to say. So what I try to urge my patients, for people that have pre-existing symptoms and signs of like schizophrenia or bipolar disorder or borderline personality or, some of these mental illnesses, diseases, diagnoses, whatever you want to label them, is be cognizant of the food that you're eating, especially processed. This is why you really can't argue with what I kind of coined like an ancient diet, is that if you feed your body the same foods that were available 2,000 to 3,000 years ago, readily available, then you're not going to have any problem. If you want to get a bread maker, you want to make sourdough, that's going to be much healthier than what you're going to get at the store. And just for an example, it's like, let's take sourdough. If you've ever got a fresh made loaf, it'll harden over the next couple of days. All you have to do is wet it down, put it back in the oven, and then you have bread, which kind of improves gut bacteria for one. But if you get bread and let's say you bought it from the store, the classical bunny bread that everybody put, ham sandwich with Doritos on when they were growing up, that's going to mold so ungodly fast. And you can't tell me that is the best thing for your body when we can see sourdough sit in the corner, not have any effect, and improve gut health and gut bacteria over time. So
it's like you go to Aldi's. Their sourdough has flour, water. That's it. There isn't 50 other things in there. It's simple. Which is how it should be.
And it's just it's all these things. And this year, my family and I have kind of coined the phrase "all of the things." It's just all the things wrapped up into one box that you can't really explain, but somehow they're interrelated and correlated. And that is really where we're at with modern society. It's like we have a want to feed our impulses. We want to have everything, ready at our fingertips, but we also have idealistic, goals and aspirations where it's like everything's got to be perfect. I got to do it this way. I got to look this way, to speak this way. Da, 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 da. It's like it takes out the humanity. But if you get back to your roots and it's just like, hey, I'm going to do the right thing, and I'm just going to start off with treating my body with respect, and that starts with what you put in your mouth, and then it starts with what you enter through your brain, because that's also what you're feeding your body. You're feeding your body information. Where's that information coming from? And then it's
gut brain access.
Are we getting right? Are we connecting every single day? Are we going outside? Are we going on walks? Are we getting sunlight? Are we having worthwhile conversations with our loved ones? And this is the root. You like how I did that there? This is the root of humanity.
Mm-hmm. Yeah, 100% agree. Last major question I want to ask you about is, what opportunities are out there for people like myself, dietitians, sports medicine professionals, people that just want to improve their knowledge and skills and ability to apply how to look at and read different biomarkers and tests.
Mhm.
Does
So
Marek have anything? Is there any specific people you would suggest? Is there like books or resources that we could go
mhm.
to? Is it just like this, just having conversations and you got to figure it out by looking at labs over time and having conversations with people that do it a lot?
Yeah. Uh, so when I started learning and really finding my passion for health optimization, it was not what it is today. You'd go on Google back when like the iPhone 3S or 3G came out, and you would try to look up what to do with my body. Google did not have the search engine optimization it does today, and everything was very, very, very hard to find. Again, it's very niche industry. It's a very niche segment of knowledge, and there's even some talks of people studying extensively lab work and having that become more of like a PhD, like a doctorate, because really it is like this entire new segment of medication all to it, or of medicine all to its own.
Mm-hmm.
Um, in regard to your question, I would recommend looking into people like, of course, Derek More Plates, More Dates, Peter Attia, great one, Andrew Huberman, of course, who doesn't know him, and looking more so into the different segments and portions of health optimization. So it can be sport specific. Health optimization for bodybuilding will not be the exact health optimization for endurance running, and it's going to be the same thing as to what you put your body through and what you look to get out of it, what your goals are. So I would say just start with where you are. Don't think too heavily into it. Just type in Google, what is testosterone? And let the corresponding questions that you have further throughout your research lead you into more and more questions, and eventually you're going to start coming over to you know uh, case studies, meta-analysis, and you'll start to interpret different data, statistics, and then you get into the really fun stuff, and you get to kind of nerd out like me and a lot of my associates and coworkers. So it's a really awesome field, really awesome time to be alive and to participate in this. But also, you can be the one to find specific correlations and spark the ignition for another clinical study down the road. So, participating in citizen science is always fantastic, and you can Google that. There's certain organizations where you can participate and do your own clinical studies and research that as a citizen itself, which a lot of studies and a lot of things are being found and being proven through citizen science itself.
And the other big thing on my realm is, especially hearing from the special forces dietitians, is definitely getting more involved in integrative nutrition medicine or nutrition,
Mm-hmm.
integrative nutrition, which also deals with a lot of like labs and biomarkers as well. But one of my colleagues, another good saying, there's a lot of nuggets in this episode, but you know, what they would do instead of having their kids when they go to school and ask them what did they learn today, their thing they would have their kids do when they go to school is what good questions did you ask today? And then based off of
Bingo.
what good questions did you ask, did you then learn something from that question because you were curious, because you
Mm-hmm.
wanted to learn more, because you wanted to get better? Because typically when we always ask, what did you learn today? Or how was your day? It's always, it was good. And then it leads to no
Right.
organic conversation.
Yeah.
Versus when you ask questions, you're going to be curious and you're probably going to have several other answers or several other questions that are going to follow up after that to continue on that journey, to always be curious, to always ask questions, to always try to get better.
Mm-hmm. I always tell my patients, the more you know, the more you grow, the more you know, the better off you are. So, puts you at a
Yep.
more advantageous position in life. And hopefully, through the people that you're seeking help and guidance from, you can also be that resource for other people and then continue down the line. This is, good favors, good people coming together to help other people do good things, and the circle of life continues.
Yep. All right, my final thing to top it off, my fun finisher for the end. If you were to pick 3 supplements to take, what would they be?
Mm.
I know it's a tough one.
Um, magnesium glycinate. Oh, that is a tough one. Um, omega threes, yeah, an omega three ethyl ester, very high potency omega three for your heart health, and probably a vitamin D. Yeah, magnesium glycinate, vitamin D, and omega three. Yep.
That's hilarious. That's my top 3 I always recommend.
Yeah,
That's all I go to.
it's true. They're the
It's
tried and true of all health optimization.
Yep. Well, Jacob, really appreciate you taking the time out of your day to give us a ton of different nuggets. Where can people find you, locate you, have conversations like this offline, and maybe get to know more of what you do?
Sure. Yeah, you can look me up on LinkedIn. You can look me up on Instagram at just Jacob Parker. I'm really not active on Instagram a whole lot. And you can always look me up through Marek Health and book a consult with me. I'm happy to meet with you. Just let me know that you were sent over through this podcast.
Fantastic. Appreciate your time, and who knows, you may be on the future for a whole other conversation. I always tell all my guests and people listen to this, you never know where there could be a part 2 in the future.
I genuinely hope so. But Sean, thank you so much for this evening. And if you ever need anything, feel free to reach out. But otherwise, thank you for having me.
Okay, I'm going to stop it. 1 second.